Good stuff. Thanks, Ryan. Sight is one of our most precious senses, and that is why it is so important to have the best vision you can. If you wear glasses or contacts, you may have thought about having laser vision correction, but if you're not quite sure if it's right for you, joining me now is Dr. Jeffrey Gold, the medical director at Liberty Vision, to explain how it all works. Hi, thank you so much for being here.
Thanks for having me.
Good to have you. So first off, you describe yourself as a super specialist. You kind of sound like a superhero there. Is that what you are?
Yeah, absolutely. Turns out there are only 13 doctors in the entire country who only do epi-lasik, as opposed to LASIK. In LASIK, the cornea gets cut open and a flap is created. And the problem is that flap never completely heals back in place. So those people, for the rest of their lives, are subject, if they get hit in the eye just wrong and that comes loose, they've got 1 hour to find somebody to fix it, or they're going to need a corneal transplant.
Wow.
Epi-lasik involves no cutting. And the procedure I do is called custom epi-lasik because we analyze each eye beforehand to make sure we take care of all the highs and lows. And in epi-lasik, the only thing that's done is the surface cells are removed, and the laser then reshapes the second layer down, which changes the optics of the eye, so that over the next few days the surface cells grow back, and during the surgery and during the post-op period, there's no pain. The procedure itself only takes about 4 minutes, and I've done over 11,000 procedures. So I guess it's fair to call me a super specialist.
Wow, no pain, only 4 minutes. So who is a good
No
candidate
anesthesia,
for this? Wow.
No, just anesthetic eye drops. Anybody who's over the age of 18, who's tired of wearing glasses or contact lenses, or who's had problems with them, and their vision has stabilized, no prescription changes, is conceivably a good candidate. And they come into my office for a free screening, and because I have a small practice, I do all of the work. I do the pre-op, do the post-op, I do the surgery, and there's not 100 assistants running around doing all the procedures. There are rare corneal degenerations that we scan for during our custom workup, and only those couple of people a year that I see are not candidates.
Wow, wow. So what's the recovery like? You kind of described it a little bit, but you said it's not too bad.
Just like the procedure being quick and painless, the recovery is quick and painless. They go home, go to sleep for a couple hours, get up and go back to normal life activities. Restrictions are no hard rubbing of the eye, no shower or swimming water in the eyes for the first week, and no exposure to tobacco smoke.
Pretty easy.
Read, TV, computer, work, go dancing, whatever they want to do.
You can dance with your new vision, right?
Absolutely.
I like it. So do you have a special at this point?
Yeah, we offer for anybody who calls in and has watched this program and mentions it, they get a $200 per eye discount, and we've also extended that to first responders and active and retired military to honor their service.
Oh, I like that. All right, great stuff. And for more information, you can always head to libertyvision.net, or you can call 203-281-5745. Well, coming up here on CT Style.